In clinical stage 4 of HIV, this is when the immune system of the body is severely weakened and an individual gets a variety of opportunistic infection which attack a weakened immune system of the body, in the end causing debilitating illnesses, and hence the complex called AIDS, that's acquired immune deficiency syndrome. And in clinical stage 4, an individual will have all the signs and symptoms of HIV, ranging from the first stage, clinical stage, second stage, third stage, and also in the fourth stage. But the difference is that in clinical stage 4, the symptoms are always, or the illnesses present in a poor prognostic state or present in a worsening state. And in this case, an individual has a very high viral load and a very low CD4 cell count, and therefore it's an emergency. In this case, I call it an emergency because if the individual having the acquired immune deficiency syndrome does not get tested and diagnosed and initiated on ART treatment as soon as possible, an individual can lose his life. And in most times, the HIV infection might not kill the patient. However, the opportunistic infections which are occurring to an individual having AIDS are most likely to cause the death of an individual. And the common opportunistic infections in clinical stage 4 include the following. Number 1, cryptosporidiasis. 2, isosporiasis. 3, extrapulmonary cryptococcosis, e.g. cryptococcal meningitis. 4, extrapulmonary tuberculosis, that's to say tuberculosis of the bones, tuberculosis of the joints, tuberculosis of the skin. All other parts of the body or other organs can get tuberculosis. 5, cytomegalovirus virus of the organs other than the liver, the spleen, and lymph nodes. For example, an individual might get cytomegalovirus virus affecting the eyes and any other organ of the body. 6, candidiasis of the esophagus and the buccal cavity. 7, Kaposi sarcoma. Kaposi sarcoma is normally observed sometimes. That's a cancer which is normally observed sometimes on the skin or inside the mouth or another part. 8, disseminated endemic mycosis. 9, chronic herpes simplex. 10, HIV encephalopathy. Amongst others, diseases like pneumonia, for example, pneumonia, Carini pneumonia, some people call it pneumonia, Girovic pneumonia, are some of the end-stage diseases which occur in clinical stage 4. And in this case, on a general observation, if an individual is not on treatment, an individual will present with generalized body wasting, greater than 10%. An individual may still have chronic diarrhea or persistent diarrhea, like observed in clinical stage 3, persistent fevers, persistent coughs, and all other symptoms and diseases we saw in clinical stage 2 and clinical stage 3. But the difference is that in clinical stage 4, an individual will present in a poor health state and therefore needs urgent treatment, diagnosis, and management. We therefore advise everyone to carry out HIV tests as soon as possible. And if noted positive, ensure to start treatment as soon as possible in order to delay the poor prognosis of the disease. Remember, HIV currently has no cure, but can be prevented. And in case one is found to be HIV positive, free antiretroviral drugs are provided by different governments to improve the quality of life of people living with HIV. Therefore, for those who are negative, keep safe. And those who are positive, keep a positive living. Thank you. See you in our next video. Bye-bye.